本日はデジタルヘルスバーチャルサミットをご視聴受けたまわり誠にありがとうございます。司会を務めさせていただきますイスラエル大使館経済部早尾健二と申します。JETRO イスラエル輸出機構イスラエル大使館経済部共催のもと、イスラエルの医療機関におけます取り組みをはじめ、デジタルヘルスの技術のご紹介のほか、イスラエル企業とのパートナーシップの実例、2カ国間におけます助成金制度に関しましてもご紹介申し上げます。1点皆様にお願いがございます。登壇者へのご質問に関しまして、現在ご覧いただいております Zoom 上の Q&A 機能を通じまして受けたまわります。イスラエル企業の名前を明記の上、ご質問事項を英語にてご表示願います。また、後日、JETRO および大使館経済部にてもご質問を受けたまわります。それでは、これよりセミナーを開始させていただくにあたりまして、共催団体よりご挨拶申し上げます。まずは、JETRO デジタル貿易新産業部新産業開発課課長、浜田昭康よりご挨拶申し上げます。浜田様、お願いいたします。
JETRO の浜田と申します。私の部署で人員事務局を担当しております。Ladies and gentlemen, thank you very much for participating in the Digital Health Virtual Summit. My name is Akikazu Hamada from JETRO headquarters. I'm taking a role of the Director of Gene Secretariat, Japan Israel Innovation Network at Japan side. すでにご存知の方もいらっしゃるかと思いますが、ジンは日本とイスラエル企業の間のイノベーションを一層促進するために設立された官民連携のプラットフォームです。この枠組みは2017年5月の両国の経済大臣による日イスラエルイノベーションパートナーシップに関する共同声明を受けて発足したものでございます。As you may have already known, GEN is a platform initiated by Israeli and Japanese government aiming to promote innovative activities among firms in Israel and Japan. This initiative has been formulated by the Ministerial Joint Statement on Japan-Israel Innovation Partnership back in May 2017. 以来、JETRO は人事務局としてイスラエル側と連携した各種セミナー、ミッション派遣、受け入れ等の事業を行ってまいりました。始めて3年経ちましたが、人員関連のセミナーは開催60件を超えまして、3000名を超える参加者をいただいております。関係機関の協力の下でこのように発展していることを非常に嬉しく思います。Since then, JETRO has organized several seminars and technical visits to both sides in Japan and Israel as a state secretariat of GEN. Around 3 years have been passed from its establishment. GEN seminars have been organized over 60 times and we have over 3,000 participants in total. We are proud of such progress of GEN under the cooperation of JETRO organization in Israel and Japan. 2019年1月に日イスラエル両政府で MOC が締結されまして、デジタルヘルスについては昨年度からビジネスミッション、ウェビナーと続けてまいりました。今回も先端的なスタートアップに参加をいただいております。本日は200名を超えるご参加をいただきまして、皆様の関心と期待の高さを実感しているところでございます。こうした期待にお応えできますように、今後もGENの活動を続けてまいりたいと思います。Since the government of Israel and Japan signed the Memorandum of Cooperation on Digital Health Aid in January 2019, we have focused our cooperation in that area. We also welcome eminent digital health startups to this webinar. Today, we have over 200 participants in this webinar, and that shows your high interest and expectation to GEN. We sincerely continue to organize GEN events to respond to your expectation. 先月からGENのポータルサイトを JETRO のホームページ内に開設をし、各種イベントをはじめ関連情報を発信しておりますので、ぜひご覧いただければと思います。最後に本日のご参加に改めてお礼申し上げますとともに、セミナーが記者のビジネスに貢献できますことを記念しまして、私からの挨拶とさせていただきます。Finally, let me inform you that we have launched a GEN portal site in May and provide event information and news related to GEN. So please access to GEN portal site. Last but not least, I really appreciate your participation to this webinar. and hoping this make good things happen to your business. Thank you very much.
浜田様、ありがとうございます。次に、イスラエル輸出機構ヘルスケア部門担当官、マンド・アルファサ氏よりご挨拶申し上げます。マンドさん、please kindly proceed.
Konnichiwa, and thank you, Genji-san. Hello, everyone, and thank you for joining our Japan-Israel Digital Health webinar. I would like to start my speech by thanking our partners in the Israel and Economic Trade Mission to Japan and JETRO for their cooperation and efforts in organizing this unique event. And also thank to the great panelists joining this session from Israel and Japan. My name is Mando Alfasa, and I'm representing the medical device and the digital healthcare sector of Israel Export Institute. Our department works to facilitate trade opportunities and strategic alliances by performing a variety of projects and business activities in different geographies to remove barriers and advance the integration of 1,100 Israeli medical device and digital healthcare companies into the global market. Israel digital health industry has its roots in a long history of using innovative communication technologies to improve healthcare delivery. With more than 25 years of expertise in implementing healthcare IT, electronic medical records, and business analytics, today our government is investing strongly in IT and putting Israeli expertise in international demand. Currently, there are 550 Israeli companies in the field of digital health, targeting the different technology and therapeutic scopes and improve the lives of millions of people around the world. Japan is a strategic destination for Israel and a promising potential market for the Israeli medical device and the digital healthcare sector. In the last 5 years, we have been organizing several business events and activities in the Japanese market together with our partners in the Israel Trade and Economic Mission to Japan. And every year, we discover more and more Israeli companies expressing interest in the Japanese market and taking part in our activities. As of 2020, over 20% of the Israeli companies in the medical device and digital healthcare industry are exporting to Japan. Our department is a leader in business matchmaking between more than 1,100 Israeli medical device and digital healthcare companies and worldwide business partners at all levels. Today, we will give you a taste of 5 Israeli digital healthcare companies in the areas of AI, machine learning, remote monitoring, and labs. To explore more companies and technologies, please feel free to contact us, and we will be happy to identify and match suitable potential business partners for you. We wish you a pleasant time watching this session, and thank you.
最後に、経済部代表、経済講師を務めます、ノア・アッシャよりご挨拶がございます。ノアさん、please.
皆様、こんにちは。Thank you everybody for joining this webinar. This is the first time that we are holding our annual digital healthcare delegation via virtual means. I hope all of you will enjoy this very interesting webinar. First of all, I would like to thank our partners for co-organizing this event with us. JETRO, thank you so much, Hamada-san and Yoshida-san, Israeli Export Institute, as well as the Innovation Authority. Jean, that Hamada-san has mentioned before, the Japan-Israel Innovation Network that has been active for the last 3 years, has been a tremendous milestone in terms of the Israeli and Japan relationship. We are very thankful for this network, and we would like to continue and promote our events through this network, through Jean. With the situation that we are facing today, combined with the problems of the aging society that Japan has been facing, we think that the digital healthcare technologies could be very relevant to the Japanese market. We hope that the speakers today, both from Japan and from Israel, can shed some light on these issues as we collaborate together to find resilient solutions. Unfortunately, I'm about to complete my term here in Japan. I've been here for the last 6 years, and I'm very grateful to you, to all of our partners, and to the experiences that I had here. We have seen tremendous stride in collaboration in digital health between Israel and Japan, as well as in other fields. And I would like to thank all of you to contributing to that. It is my hope, along with my colleagues at the Israeli Ministry of Economy and other organizations that are partners of GENE, that we continue this strong partnership. I thank you again and appreciate in advance your continued support to our team and to our partners. Good luck, everybody, today. Arigatou gozaimasu. Thank you.
それでは、イスラエル企業との共同開発に取り組んでいただきます、日本企業様を対象といたします、2カ国間におけます助成金に関しまして、NEDO 国際部デピティディレクターの水口氏よりご説明申し上げます。また、イスラエル側の助成金運営担当機関であります、イノベーション庁アジアパシフィック担当官エラヘラ氏よりもご挨拶申し上げます。皆さん、please kindly proceed.
皆様、こんにちは。エラと申します。よろしくお願いいたします。I switch now back to English. Please, I would like to welcome you to this wonderful webinar, and it is, I think, a great opportunity both to Japan and Israel. A short introduction: the Israel Innovation Authority is the Israeli government arm for funding R&D. And we also do that with Japan, and I think my colleague from NEDO, our counterpart in Japan, will give further information. We just wanted to share with you that we can help with the Israeli side to support the R&D expenses, and of course, if needed, to find a relevant partner in Japan. And vice versa, if the Japanese companies are interested to find an Israeli partner, please contact our colleagues in NEDO. This is my contact information. And please let me present my colleague from NEDO, Mizuguchi-san, to explain further about the joint collaboration in Japanese. Mizuguchi-san?
水さん、アンミュートでお願いいたします。
はい、エラさんありがとうございます。ただいまご紹介に預かりました、国際部の水口と申します。この度は、イスラエルにご関心をお持ちの日本企業の皆様に、その支援事業を進めさせていただける機会をいただきまして、ありがとうございます。本ウェビナーの主催者であるJETRO様、イスラエル大使館経済部様、イスラエル輸出国際協力機構の皆様に改めまして感謝申します。それでは説明をさせていただきます。本日はですね、NEDO とそれからイスラエルイノベーション庁がして実施しておりますコマンド事業を通じた日本とイスラエルの企業間の共同研究開発の進捗についてご説明させていただきます。正式名称、国際研究開発コマンド事業と申します。で現在ですね、2020年度事業の公募期間中でございまして、今年の6月8日に公募を開始して、9月の10日締め切りとなっております。こちらが公募ウェブサイトの URL でして、下が事務局の電話番号、それからお問い合わせのメールアドレスとなっております。プレゼンの最後にもう一度このスライドを掲載しますので、もしご関心をお持ちの方はですね、写真を撮っていただいて、後ほど質問をですね、こちらのメールアドレス宛てにお気軽にいただければと思います。こちらが、コマンド事業の概要と記事になります。日本企業が優れた技術を持つ外国企業と共同で実施する国際研究開発プロジェクトに対しまして、
NEDO とイスラエルの場合はイスラエルイノベーション庁、IIA と略称で申し上げますが、が並行して、それぞれ自国企業の研究開発費用の一部を助成する制度でございます。この事業を通じて、制度としましては、企業の国際オペイノベーションを加速し、革新による国内外の新規市場獲得を出すとしております。今年度の事業の公募につきましては、この場で詳しくはご説明いたしませんが、このユーレカというですね、欧州中心イノベーション支援機関のネットワークを活用した多国間共同公募の形で行います。従来は IIA と NEDO の2国間の公募をしておりましたが、IIA もですね、ユーレカのメンバーでありまして、今回はこの対象7カ国合同の共同公募となっています。ただし、ご提案はですね、従来通り日本企業とイスラエル企業の2国間でご提案いただくことができます。にしましては、こちらの図が示しております通り、日本企業様と、それから共同研究を行うイスラエル側のパートナー企業様が、それぞれですね、日本側は NEDO に対して提案書を提出いただきまして、パートナーのイスラエル企業様は IIA の方に提案書をいただきます。これをそれぞれ NEDO、それから IIA が審査をして、両国ともに採択となりましたら、初めてこの事業が成立する仕組みでございます。では、日本側、NEDO 側の支援内容をご説明いただきます。実施としましては、助成事業でございまして、日本の事業者様の事業費の一部をNEDOが補助させていただく。補助率に関しましては、中小ベンチャー企業様に関しては、3分の2。その他大企業様を含めまして、1となっています。事業の実施期間は、交付決定日から24ヶ月以内となっております。当事業規模ですが、日本側の助成対象費用は1億円を上限といたしまして、その費用に対して上記の補助率をかけたものを NEDO から助成させていただくとございます。応募者要件は、日本国内に研究開発拠点を有している、単独の日本企業様、ないしは、複数社で、共同提案をしていただくことも可能です。また、大学、もしくは研究機関の、もですね、共同研究者、もしくは、下請けといいますか、一部委託先として、参画いただくことが可能です。対象技術といたしましては、NEDO が所掌するあらゆる産業技術としていまして、ただし、原子力と創薬分野を、除外するとなっております。こちら、NEDO 側の助成対象費用でございますが、簡単に申し上げて、こちら、1、2、3、4に分かれます。装置等物を買う費用、それから研究員の方々の実験費、その他経費ということで消耗品ですとか、出張旅費、それから外注費ですね。4番が、一部、研究開発要素を外注するの委託となっています。イスラエル側、企業側の費用はですね、NEDO の助成対象とはなりませんで、イスラエルイノベーション庁の支援制度に、がございます。その、IIA 側のですね、支援制度の概要をこちらに簡単にまとめています。詳しくはですね、IIA の方にイスラエル企業側から問い合わせていただければと思いますが、日本企業の方もですね、どういった制度なのかというところを参照されたい方かと思いますので、こちらご参照いただければと思います。イスラエル側の補助率は最大で 50% と聞いております。その時の状況に応じて任意の率が設定されるとなっております。上限額についても設定はないとは聞いておりますが、これまでの実績を見ますと、おおむね日本側の助成規模とですね、それほど変わらない規模で助成化されています。実施期間は最長2年で、NEDO と同じとなっております。続きまして、採択案件の選定プロセスとスケジュールですけれども、6月8日に公募 すでに開始しておりまして、9月の10日に締め切りとなっております。でその後ですね、日本側、イスラエル側、それぞれ審査が入りまして、12月中旬に合同のコンセンサスミーティングを開催して、最終的に採択を決定するということで、スケジュール的には来年の1月がですね、最速の交付決定時期となります。こちらご参考ですけれども、イスラエルでですね、過去に9件のコマンド事業が採択されております。こちらのNEDOのコマンド事業のウェブサイトでも同じ情報が参照できますので、詳細まではご説明いたします。こちら、改めまして、NEDOの問い合わせ先の情報でございます。ご質問、ご関心、何でも結構ですので、お気軽にですね、ぜひご連絡いただければと思います。私から以上になります。ありがとうございました。
皆様、ありがとうございました。皆さん、ありがとうございます。次に、ランバム医療機構にて CEO を務めます、マイケル・ハルベルタル氏より、当機構におけます取り組みやビジョンをお伝えいたします。マイケルさん、please kindly proceed.
Hello all, thank you very much for inviting me. It's a privilege to be with you here in Haifa, in the northern part of Israel. My name is Michael Halberthal. I am a physician, pediatrician and intensive care physician at Rambam for many years, 34 years, and I am the CEO of the Rambam Medical Center. I will put up the presentation that you'll be able to see. Okay, I hope everybody sees the presentation. I would like to thank Israel Expert Institute, the Ministry of Economy and Industry, the JETRO, for this event. And I will concentrate and talk to you about the events of the COVID-19 in Israel as a whole and at Rambam, and show you some of the stuff that we have done here and some of the collaboration that we had with the industry. So just for you to get some knowledge, what you see in this picture is the Rambam Healthcare Campus, all this area. It's an academic medical center affiliated with the Technion. You can see the white building here on the left is the medical faculty where I studied medicine. We are the only tertiary care center and the trauma center of the northern part of the country. So we cover 2.3 million people, and we are located in Haifa next to the port and next to the Navy bases. Rambam has 1,100 beds. So it's a 1,100 academic facility and 5,300 employees. And just connecting to the event, this building that you see over here is the Hemsley Discovery Tower, and this is the future. This is a tower that will deal with innovation, research, and startups. So let me tell you some details about the Corona event in Israel. Like elsewhere in the world, it started here at the beginning of this year. And what you see over here is the first hump that we had between the February, March, and April of this year, when we had patient and accumulated patient. And with the total lockdown, we subside with an amount of the rate of infection. It went down, but in the last just over a month, when we started to open the economy, what we see immediately after that, that we accumulate more and more patients, and you can see the sharp increase in the amount of confirmed cases that we have in Israel. And you can see that now every time we have, like every day, somewhere between 1,500 to 1,800 new cases a day. The amount of mortality in Israel is low. We have, so far, since the beginning, we had only 375,000 people dead. and the amount of the morbidity, you can see here at the bottom, only currently now all over the country, Israel is 9.2 million people. We have 57 ventilated patients and just around 200 severe patients. So this is where we're at, and I will drill down and tell you about the events that happened at Rambam since the beginning of the COVID-19 pandemic. At the end of January, we had a request from our Ministry of Health to use our negative pressure isolation rooms, and we have about 12 around the hospital for COVID-19. But shortly after, we were asked to open a specific designated ward ground department. And initially we were asked, and you can see in the screens in the video on the right side, how we formed those departments. A first department of 30 patients with 6 ICU. And since then, we were asked to build another department of 66 patients. And you can see all of them over here with telemedicine, monitoring from far, and about 32 ICU patients. And we can extend to another 12 to 14 ICU patients. So altogether, 80 patients. So far, from the beginning of the episode, in the initial part, we got 96 patients. And now in this part, we have about 140 patients. So the unit is busy, but it's not untolerable. But looking into the future, into the event that we might lose control on the COVID-19, we were asked to open another facility. Now, in 2006, we had a war with the northern part of Israel, and the missiles were falling around us, and none of the hospital was protected or fortified. The staff was not protected, and not the patient. So after that, we've built an underground parking lot. Each level is about 20,000 square meters or 5 acres, 3 levels of, on usual days, it's a parking lot. And in an emergency, it converts to the biggest underground hospital in the world of 2,000 beds. I will show you another clip at the end. We were asked to use this facility that has all the infrastructure in the walls that will be able to admit 900 patients and 300 ICU patients. So far, we are not using this facility. It's a contingency plan. And we have this facility if we, looking at the morbidity, if we will lose control on the event. There were a few things that were very exciting about the event. You know, talking about the pandemic as exciting, but some of the things that, you know, as a CEO of this big hospital, no doubt the first thing that was amazing is the effect on the staff. 5,300 staff people that came over and wanted to help and wanted to join in order to treat our patient, and this is our mandate. The second thing is the collaboration that we had with the industry. Now, Israel has no too many health industry companies, like local health industry companies. Obviously, we have all the international ones, but local industry like Elbit, Rafael, that most in regular days, they are dealing with other kind of industry, most of them dealing with in the weapon industry, army units, like all kind of units, reconnaissance units in the army that have capabilities, came over and asked us, what do you need? What do you need in order to be able to cope with this extreme scenario? And we sat as a hospital and we told them about our unmet needs, and they came over and within 3, 4, 5 days, using what we call the brain power of Israel in order to find solution. And I will give you some examples of the solution that we had, just, you know, really few of them. Elbit system, we had a major issue. Once you move into the phase 4, 900 patients, it became a huge logistics and control issue. It's much more than medical issue. And they built a solution for us using a military system of command and control that you can locate each and every staff of the hospital. You can see who are they, where are they stationed, and you can use them around the hospital, and there is also communication between them. So we made a control and monitoring system. It's an unbelievable system that really, without it, we will not be able to control whatever is happening in the underground hospital. Another co-view system by another industry from the weapon industry, Mafat and Rafael, they built a control and monitoring system that you can see a resemblance to get a display of a snapshot of personal data, critical equipment, patient status, and all kind of intra and inter hospital connection, logistic solution, attendance, and all the rest. Another issue, because we didn't have enough monitoring and ventilators, and we started to receive monitoring ventilators that are not used to see in Israel, and some of them do not connect to our EMR, the electronic and medical records. We asked another industry, Rafael, that most of the time they're dealing with, again, the weapon industry, and they used a method of capturing the screen of the syringe pumps, of the ventilators and the monitors, picking up from the screen the numbers that we need and putting them on display as a control monitoring data of each and every patient. And on each and every patient, you can see on screens exactly all the vital signs, the ventilation setting, and the drugs that he's getting. All kind of other industry like BioBit. BioBit, it's a monitoring system from far that you put a device on the chest of the patient. The patient can walk, and you get 16 parameters of cardiac output, all kind of the vital signs, and that you can see, and all kind of telecommunication system that we can treat patients from far, which is part of the events that we needed to do. With the Technion, we dealt with the issues of diagnosis. All of us around the world had major problems with the resources for diagnosis, for swabs, reagents, and lab resources. The Technion came with a pooling system, pulling clinical RNA samples, and to the point that we can gather in one sample 32 samples and see one positive sample out of the 32. There are already literature, it's published around the world. You can look into it. And now we are implementing this pooling system that saves lots of manpower and lots of work to diagnose the patients. And we had some more system how to diagnose patients that are deteriorating using early recognition of respiratory failure by speech analysis and so many other things. Another issue that all of us are facing is the protective gears. That the protective gears are extremely cumbersome, extremely hot, not easy to stay. And this is why one of the Israeli intelligence unit built us this, that we can put it above us and to protect the face and the area once you put the mask and the gowns. And it's much better. And another one that you can see that has also ventilation inside, that it's not so hot. And there is also a protection of airflow in front of the face to prevent chances of staff being infected. I would like to finish with a small clip that will show you the underground hospital and the effect that we had in Israel at Rambam. This is the Haifa. This is Haifa and the hospital. This is the president of Israel. talking. This is the underground hospital coming down to the underground hospital, putting all the infrastructure. You can see the size, the magnitude of this place, and you can see the intensive care beds. This is the Bibi Prime Minister of Israel talking. And you can see the wards, the crown wards, labs. You see the intensive care area. Aragoto gozaimasu. Thank you very much. What you see over here, the Independence Day of Israel, the Israeli Air Force aerobatic team had a tribute to the medical facilities, and you can see Rambam here below them. And I appreciate your time and listening to me.
Thank you very much, Dr. Halbelta, for your perspective and sharing the experiences. では、イスラエル企業5社のピッチに移らさせていただきます。まずは遠隔診断系のTyto Careより、戦略担当をしております、イヤルバウム氏が発表いたします。イヤルさん、please proceed.
Hello, everyone. Thank you for joining. My name is Eyal Baum. I'm Director of Strategic Accounts from Tyto Care. I'll give you a quick and focused introduction about our company, about our product, and I will give some emphasis about our activities related to COVID-19. So just an overview about Tyto Care. So Tyto Care, we are a telehealth company. We have a full telemedicine solution, providing both an end-to-end platform for telemedicine, including video conferencing and a mobile app and everything needed to connect between patients and doctors everywhere. But in addition, and that's what makes us unique, is that we've developed a set of connected tools, a health kit, that basically enables a remote physical exam. And you can see here the devices, a stethoscope to listen to the heart and lungs, otoscope to look at the ears, examination camera with a tongue depressor to look at the throat, skin camera, thermometer. Basically, we are targeting primary care and pediatrics, and we are adding for virtual consultation, for telehealth session, either over video or phone. We are adding another layer of the examination. Basically, we know that by having just a phone, just a video, enables some conversation, enables some understanding of the patient, but still do not provide the same depth and the same clinical understanding for the doctor to really provide full treatment, and allow him to provide full diagnosis and save the visit. And this is what Tyto brings to the table. We think we are the third generation of telehealth that really replicating what you as a patient and what you as a doctor get in a virtual consult without feeling you're compromising on the level of care you get remotely. So this is just an overview about our product. We have a web clinician app for the doctor. We have a mobile app for the nurses, or in nursing home settings, or for consumers at home. The platform is fully secured, HIPAA and GDPR compliant, and we have a flexible API to integrate with different EHR or other telemedicine platforms. In terms of product, we have two product lines. One is the Tyto Home for home use, families, elderly, or chronic patients. And we have Tyto Pro for professional use, which can address and be relevant to many use cases, like traveling nurses to care homes, retail pharmacies or remote clinics, employers' virtual clinics, schools, ambulances, and more. This is a glimpse about our partners. we are working on a B2B mode, meaning we are always partnering with a health system, with a health provider, health insurer, or any type of health organization that has doctor and patients and want to offer telemedicine service at different kinds. So you see our main market during the last 3.5 years was the US. We have about 80 or more health system using Tyto in different kinds of usage, like Kaiser Permanente for home care and remote clinics. We have Clew in Israel, which is the largest HMO in Israel and second largest in the world, 4.5 million covered patients. They are offering Tyto during the last 2 years in a quite large scale. Also, Sheba Medical Center just added it to their arsenal, especially for COVID. In Asia, we have Samiti Veg hospitals from Thailand that use Tyto, both Tyto Pro and Tyto Home. We have different insurers like Ansem, Suica. Suica is a big health insurer in Switzerland that offering Tyto Home to their members. They've started just recently this year, already thousands of devices deployed. AXA, we are working with their telemedicine provider Care in pharmacies. And Pingan, we have this is one of our investors in China. So you see, this is our general partner, so this is our go-to market. And also for Japan, we are looking for such health provider, insurer, or other type of organization that providing telemedicine service. Regarding COVID, so in general, we are active in different use cases. Each hospital, home care service, or HMO is using Tyto a bit differently in remote monitoring for patients with mild symptoms like home hospitalization, traveling clinician to elderly care home, triaging, senior care facilities. I will elaborate it further in Europe, like in the UK, Italy, France, Switzerland, Israel. And we have a lot of experience in that aspect, and quarantine sites in hospitals. So let's give a few examples of such projects that we have. First of all, there is some short video. I will not show the entire video, but this is a video showing Sheba's usage of the Tyto home kit for patients with mild symptoms with COVID that are admitted to the home. I will jump this video, but just to give you a notion about how a Tyto visit looks like. So you see, this is the online visit where the doctor and the patient are basically doing the examination together. You do not understand Hebrew, so I'll mute it, but I will just explain. You see, the doctor is doing an online visit with our platform. He's talking to the patient and seeing the patient, but he's in remote control of the device. He's measuring the temperature, he's listening to the lungs, you know, which is very relevant now with COVID to make sure there is no deterioration of the patient condition. And basically, this is what helps the hospitals to feel confident to release more patients to the homes and saving beds in order, but without feeling they are taking too much risk. So it's not just video, not just phone, but real physical exam. You see here, the patient is putting the stethoscope on the chest, enabling the doctor to listen to the lungs functions, to hear there is no infection or pneumonia, and make sure it doesn't need to come back to the hospital. So this allows Sheba and other hospitals and the HMOs like Clew to release more hospitals to the home. So this is a quick overview about how an online visit in Tyto looks like. You see, it's a very interactive experience. It gives a lot of confidence to the doctor to feel they are not taking risk while treating patients remotely. So after Sheba, you know, and by the way, the first usage of Tyto with COVID was after the Diamond cruise ship from Japan, the Israeli that returned from Japan. This was the initial usage of Tyto with COVID, but since then, almost all hospitals, including Rambam, as they showed, using Tyto with quarantined areas. Also in Thailand, as I said, they are using Tyto in many hospitals, both government hospitals and the hospitals of BDMS group, and also in home use, you know, to saving patients coming from the hospital. This is a partner of us, Freiburg Hospital, a big government hospital in Switzerland. that are using Tyto with a team of nurses that are doing home visits, especially to elderly patients, coming to homes and allows them to monitor those patients without bringing them to the hospital. Also, we have such a project in Italy with Vercelli hospitals. And last example is a kiosk that we are located both in the US with our partners like Oshner and Ovant, and also is Israeli Corona hotels, that patients can come to this room and allow the doctor to do the physical exam. That's it from my side. I appreciate your time and take care.
Yes, thank you. 次の3社は、画像診断系となります。まず、ゼブラより CEO のオハット・アラジ氏が発表いたします。オハットさん、please proceed.
Hello, everyone. My name is Ohad Arazi, and I have the privilege of serving as the CEO of Zebra Medical Vision. I'm extremely happy to be here with you today and proud to be on a panel representing innovative Israeli and Japanese companies. Let me just quickly share my screen. Excellent. So let's take a few minutes talking about Zebra Medical Vision. Our company is on a mission to transform patient care by teaching computers to automatically read and diagnose medical imaging studies. Our AI solutions help radiologists by automating the interpretation of medical images for certain types of conditions. And the way our technology works is that we receive a copy of all of the scans that are taken at a particular hospital, and our software reviews the images and provides an initial diagnosis even before the radiologist has ever looked at the exam. This doesn't replace radiologists, but it's an important complement. I always like to say AI will not replace radiologists. Radiologists that use AI will replace radiologists that don't. Now, the challenge with radiology is that with the continuous growth in medical imaging volumes and complexities, we're quickly reaching the human limit for effective interpretation of these images. So Zebra is looking to empower healthcare providers to manage the ever-increasing workload without compromising quality of care through the use of machine learning and AI. One radiologist on average reads about 50 CT studies a day, and each study has 400 images or more. So on average for an 8-hour workday, that's 20,000 images to read, which means that each radiologist spends 1.6 seconds looking at every image. So I like to think of this as like the autopilot solution on a long transatlantic flight. You know, you wouldn't want the computer to do the takeoff on its own, to fly the plane for 12 hours in bad weather, and then to land it. But you're also very happy to know that it's there supporting the pilot on such a long journey. From a technical standpoint, very, very simple product. We interface the hospitals at the PACS or the modality level, basically where the images are acquired, and we de-identify them on site. So no protected health information ever leaves the hospital. Then we provide the analysis of the images either on the cloud or on premise, more typically on the cloud, which again isn't an issue because all the data was de-identified at the local hospital facility. Once the analysis is complete, we send the data back to be re-identified and then consumed typically in one of two ways, either in the viewer of the radiologist, that's the cockpit that the radiologist used to interpret the images, or through the work list, which is what prioritizes the queue, prioritizes all of the studies that we're looking to interpret. And I'll talk to you a little bit about which algorithms and which disease states we cover. So today we have 6 products that are FDA cleared, or 5 and one that's about to be cleared. We have a total of 5 products that are cleared by Health Canada and 9 CE marks. We're currently working on our regulatory approval in Japan as well. I'm very happy to update. And the way that I look at our products is I group them into 3 main use cases. If you start on the left-hand side, these are use cases for triage products. This is about triaging critical cases, so prioritizing cases that have critical findings and creating a safety net for radiologists. And we do that for head CT as well as for chest X-ray. And so if you can imagine that if a patient walks into the hospital with, let's say, head trauma from a car accident. And so our product reads that exam as soon as the image is acquired, even before any radiologist has looked at it. And in case we detect an intracranial hemorrhage, or a brain bleed, we can immediately alert the care team to know that there's potential here for a very severe case, an acute case that would require intervention. And that substantially reduces the turnaround time for critical conditions. In the middle, you find our screening products. This is all about screening patients for conditions that need follow-up and to provide another set of eyes on that particular finding. I'll give you the example of mammography. In all of Europe, there's a mandated requirement for a second read of a mammogram. So when a mammogram is taken, it is first read by a radiologist, and then each mammogram has to be overread by a second radiologist to make sure there aren't any misses. What we provide is the ability to provide the second reader through machine learning, where the initial image is interpreted by the radiologist, and then our software can do the second read. In case of discrepancy between the human reader and the machine reader, it can be adjudicated by another human reader. So that's an example of how we use our screening products to monitor conditions that aren't acute, but that require regular follow-up, like mammograms or like pleural effusion, which is the development of fluid in the lungs. And then on the far right, we have our population health products. And this is all about detecting incidental findings and missed care opportunities via routine scans. So a good example of this is what we do in bone health. So we go over every CT that's taken at the hospital and for any indication. So, someone might arrive at the hospital because of a rib fracture. And while the radiologist is interpreting the rib fracture, we run in the background and see if there's also compression fractures in the spine of the patient, which, as you may know, is a leading indicator for osteoporosis. And so based on a study that we did at Oxford Health, we detect 70% more cases of osteoporosis by scanning patients, by scanning the compression fractures of patients in their vertebra. We do the same thing for coronary artery disease, where we quantify and manage the amount of calcium buildup in the coronary arteries of the patient. And again, we do that based on incidental findings, meaning it can be invoked on any CT for any indication. We run in the background and notify the care team in case we identified any substantial risk. One last product I'll talk about is our COVID-19 solution. So we developed software for a machine learning algorithm that analyzes CT scans and automatically detects and quantifies COVID-19 findings. And we do that by providing a lung burden score, basically an analysis that calculates the percentage of the affected lung volume. And that enables providers to predict the trajectory of patients with COVID-19 as a decision support tool for the allocation of ER and ICU resources. And this is a patent technology. It's already deployed in 3 countries, including at Northwell Health, which is the largest health system in New York State, and actually the largest COVID hospital in the world, as well as it's deployed through Apollo hospitals, where they have 71 facilities that are sending chest CT scans to a dedicated COVID reporting center that uses our software. This is just to give you an idea of what the product looks like inside the radiologist cockpit, where both at the work list, which is what you see here on the left, we can indicate the suspected finding and increase the priority in case it's an acute finding. And then on the right, you see the view, and what you're seeing here on the far right is our product, which is identifying where, in this case, where the pneumothorax was. And you can do that. You can see that it's an indication with a yellow polygon there around the finding. In addition to our products, Zebra has some very substantial strategic assets. We've got incredible talent. We've had $57 million invested in our company, and that's allowed us to build the largest staff of AI technologists. We have 87 employees today. Data, as you may know, machine learning is a form of artificial intelligence, right, that teaches computers to think in a similar way that humans do. And in order to do that, you need past experience, you need data. And so access to data is really foundational to all AI solutions, and Zebra has access to over 30 million patient records with their full longitudinal history. That includes the orders, the images, the reports. We have the most FDA cleared products in the industry with a very strong regulatory pipeline and substantial research publications to validate the efficacy of our solutions. In terms of deployment, we're deployed at over 130 sites worldwide, including quite a few in Asia where we've been gaining traction. We're currently developing a partnership with Dr.net in Japan, which is the largest teleradiology practice, and also working in Japan with Amgen and Astellas. So we're really starting to gain traction in Japan and really maintain a very global view of both radiology reading groups, hospitals, academic institutions. And you can see we've built up a big network in North America over recent months. In terms of our partnership with Japan, we're looking to start the journey with a no-risk introductory business model because it's a cloud-based solution, very easy to deploy in a SaaS model, very predictable in terms of the licensing fees, a lot of flexibility in terms of where we can start. And then we provide dedicated technical, clinical, and account support remotely to any Japanese installs, and also to create tremendous publishing opportunities, as Zebra's been investing heavily in clinical research and publications. We published in over 11 journals, including most recently in Nature Med magazine. We have 2 more publications coming, and we'd love to find a Japanese research partner to collaborate with. And then finally, we've got a very deep bench in terms of our team, both success in multiple startups, as well as leadership team that has worked across health IT for several decades altogether. And so with that, I'd like to conclude the presentation. Thank you very, very much for your time. We're very excited to collaborate with Japanese companies and are really looking to make a big splash in Japan. Of course, I'll be available for questions later on. Thank you very much for your time.
小原さん、Thank you. で次に、メディアルアーリーサインより戦略担当しております、オリゲバ氏より発表いたします。オリさん、please kindly proceed.
Hello, everyone. Video is stopped. Can you start my video, please? Can you please start my video? Can you see my screen? Hello?
Yes, you can start.
Okay, could you please start my video? My video is turned off. Okay. Good morning, good afternoon, everyone. I'd like to spend the next few minutes to share with you some information about Medial EarlySign and our interests in Japan. So our mission is to help healthcare stakeholders to provide better care and be able to optimize operations and address individuals at risk and guide physicians and health systems in focusing on potential complications earlier. We work on existing health records data, structured data that each one of us would have in our health records, with the notion that even information about a single patient might be big data for a human being. And using analytical approaches and mathematical models and machine learning, we process billions of data points coming from millions and tens of millions of individuals and are able to connect the dots and identify situations that are more typical for individuals that are in deterioration and help point and focus effort on those individuals in different domains. So let me just give you a couple of or a few examples and domains that we're addressing. We have today more than 20 different predictive and analytical models that we categorize today in 4 bundles. One addresses infectious diseases such as flu and COVID, and I'll address this later. There's a package of models that help to identify individuals with high risk for unplanned admissions or readmissions. There's a package of models that look at chronic diseases, such as diabetes, help to identify those that have a risk for progression for complications, or individuals that would benefit from earlier attention in order to enroll them into diabetes prevention programs. And we've got a package which actually contains some of the models that were first deployed, looking at early detection and supporting screening operations, such as lung cancer or colorectal cancer or AAA. The models that we developed are developed using a unique algorithmic framework. It's almost like a development environment for clinical AI. And it contains a lot of our know-how and expertise, and we've built it over time. And this allows us to develop models extremely fast. So on one hand, it's a very powerful tool that our data science team uses. And on the other hand, it's open to use other environments. So you can do a lot of the development that is really critical for medical machine learning and the preparation of the data, and on the other hand, use tools such as TensorFlow in order to create your models. The second piece of technology that we offer is a runtime technology. So this is an environment where we install the models that we created in our environment. And this runtime environment could integrate and provide the insights that are generated by the models into the workflow, whether it is within the care streams, decision support, or it could be in population health approaches and provide data that would be fed into care management processes. The models we developed are validated in multiple environments. We have access to tens of millions of patients' data, all anonymized and de-identified. And we take extreme care to have peer-reviewed publications on the models that we create. We have more than 14 peer-reviewed publications published, and there are quite a few on the way. And to be a little more concrete, I'll try to give you a few examples of work that we've done recently. So with influenza, we're working with health system, probably the largest integrated network in the US that is using our models to focus on individuals that might be at elevated risk for influenza complications. And they use this on top of the standard risk models, which are really rule-based, but we can really augment and include additional people that don't necessarily fall within these risk groups, or even within the risk groups, we can stratify and identify those that might be at elevated risk and help the health system to focus on these and provide extra nudge in order to help them to get vaccinated. Recently, with COVID, we've seen also shift in some of the pains that health systems have, with people not showing up for their elective surgeries or screening. There's been a backlog that was created, and we worked with one of our customers to address that specific issue by examining the queues for colorectal cancer screening and helping them to reprioritize according to the estimated risk and get those people that might be at an elevated risk earlier examinations. In response to COVID, we developed a model that we've driven based on prior knowledge and massive data coming on hospitalizations and preconditions, and created a model that helped two health systems to prioritize individuals for testing. Testing, giving priority to those that have a high risk for having COVID complications, And in retrospect, we've examined the data and we've seen that we had a very good coverage of both, unfortunately, those who died and those that had severe complications. So we've pointed out like the top 15%, and these included all of the deaths and close to 90% of those that had severe complications. And this had additional added value on age and BMI, which has been identified as high risks. We've also interested very much in kind of more advanced research, and recently we just completed a very interesting project that we've done with a pharma life science company, analyzing relationship between OTC drugs and some cancer conditions. This is just preliminary, and we hope to continue into kind of more advanced stages there. And as I told you,
Orisan, one last minute, please summarize your presentation. One last minute left. Thank you.
So we have models that work on chronic disease, and as I said, of colorectal cancer. I just want to give you an example. This is a system that is installed with Maccabi Healthcare Services, second largest system in Israel. They address this, and they want to use this model to look at individuals that are eligible for colorectal cancer screening, but are not coming to screen. So they run it in the background. Whenever someone is doing a complete blood count, they calculate the score based on the results of the complete blood count and historic results. And they managed to get like a positive predictive value of 9%. And today, up to date, they've found dozens of cancers among people that didn't come to screen. Looking at Japan, we're very interested to find distributors for our existing models. On the other hand, look at co-creation of new solutions that are tailored and address the Japanese market and could use specific interests of health systems or work with pharma and payers. We've got a very experienced team that is working in digital health and machine learning for the last 10 or 15 years. And we thank you very much for your time. Arigatou gozaimasu.
Ori-san, thank you. では次に、Clew より、バイスプレゼントで、製品開発などを担当しております、アビド・ファインさんより発表させていただきます。アビドさん、please proceed.
Thank you very much. So, my name is Avigdor Fayans. I'm the VP of Product and co-founder at Clew. I thank you for the opportunity to present Clew to you. Clew as a company was established in order to bring AI technology in order to improve outcome of critically ill patients. So we are very focused on ICUs and we are expanding now to other areas with acute care. The company was founded 5 years ago in Israel, but we are focused on the US market. We started the studies and the installations of our system in the US. And at this stage, we are looking to expand the reach of our technology to additional locations. And we are very excited to look at the opportunity to provide the technology in the Japanese market. The product is focused on improving the clinical outcomes by providing new insights to the clinicians that can allow them to be more proactive and to get insight as for pending deteriorations. And at the same time, we are looking at the ability of the models, the system as a whole, to provide improved financial results as well. We have several partners in Israel. We are currently deployed in two of Israel's biggest hospitals, the Tel Aviv Medical Center and the Sheba Medical Center. And in parallel, we are deployed in the US in tele-ICU environments, both in Massachusetts at UMass Memorial, at a location where they serve a few hospitals with 7 different ICU units through the tele-ICU environment, and at North Carolina at Wake Med, again, it's a tele-ICU installation, and I will elaborate more on that. We also have partners for deployment and sales in the US. The technology, the core technology of the company, the IPs that were developed are related to the machine learning and AI that allows us to build the predictive models. In addition to that, we have developed a complete system that will serve the clinicians. So, our objective is to provide a better and improved clinical care environment. And last, I want to mention that recently we've received the FDA authorization for the use of the system, and that allows us to start and deploy not in a test environment, not in under a medical study, but to start and allow the clinicians to use it and assist with COVID situation. So it's been in the news, and we are starting to look at the requirements for regulatory paths in additional locations. We already started the work for the EU, and we will start and examine the process required for Japan. So the overview of the system. So this is a view of a tele-ICU that where the clinician sees these 6 screens. I'm using it in order to show you the different screens of the system in one view, but at the same time, the system can be used in a regular ICU environment where the physician will have only one screen. So we deploy both in ICUs at the bedside and in the tele-ICU environment. So I'll briefly go over the different screens, and at the bottom left side, you can see the unit view. The unit view is a very important screen that allows the clinicians to see the risk stratification of the patients. The patients at the bottom will be the ones that the models anticipated that will be at low risk for deteriorations. And at the top, they'll see the patients that specific models detected potential deterioration in the next 8 hours or before. And that allows them to focus the treatment on the more acute patients or the ones that might deteriorate. So they will be able to provide the adjustments to the clinical treatment, change the medications, change different clinical procedures given to the patients. That unit also allows the physician, when he's monitoring a multi-unit environment, to quickly switch between the different units, see the acuity and the patients that require treatment earlier in different units. At the top, in the center, I'm showing the patient view, which is basically a dashboard that collects all the data. And since Clew has integrated all the data into the system, and there is a lot of work related to cleanup and improvement of the clinical data, once we have it, we can display it. And it's not just the raw data that the monitor would have or the medical record will have. It's additional data that we've processed, like scores and different additional parameters that the clinicians will find useful. At the top right center, at the top right, you'll see the screen of the work list. And this is especially important in tele-ICU, where there are many different units covered by the one physician. And this screen will aggregate all the patients that are in high risk for deterioration to the work list, and will prioritize the analysis required by the physician to the different patients. In addition, there are tools there to from the clinician side to manually add information about high-risk patients and create a task environment for the bedside and the tele-ICU, so it allows better communication and logging of the activities. So generally this, and the center below you see the EMR. It can be Epic, Cerner, or any other electronic medical record, but the Clew screen.
Victor San, it's last minute. Please summarize your presentation.
Okay, sure. So I'll quickly go to the way we develop it. We're using AI development flow with additional tools that we've developed and abilities to process clinical data in time series, because our prediction is in real time for the coming few hours. We've done studies at several hospitals, and we've tested it on different hospitals, so it can show that the technology works when you move from one hospital to the other. In addition to the predictive models, we also have tools that are rule-based system that allows the clinicians to better monitor and follow additional clinical situations and complications. The installation is very simple. It can be done on-site or at the cloud. We ingest the data from the hospital information, and the system does all the calculations in the servers over in real time. So every minute there are calculations of the predictive models and other elements in the system, and then it goes to any browser that the users has and may want to, and you can have access to a lot of new information helping the workflow. From regulatory perspective, I mentioned that we are authorized by FDA now and will work on other regulatory requirements. We're HIPAA compliant, and we're working according to quality management system required in the US and Europe. What we're looking for is collaborating with hospitals for deployment of the system and exploring the value that we provide to Japanese hospitals. And at the same time, we're looking for additional investments to facilitate future growth and strategic partners to help us and get into the Japanese market. And the team is a very experienced team of engineers and clinicians that joined in order to achieve this mission and provide better clinical care at the ICUs. We also have, I want to mention, we have a very strong scientific advisory board from top clinicians in the US. And I want to thank you all. I will be looking forward to get your questions and be able to support the Clew introduction to the Japanese market. Thank you very much.
Thank you very much. では次は、デジタル顕微鏡スコピオより CEO の遺体ハユツ氏から発表させていきます。大さん、please kindly proceed.
Okay, hi everyone. I'll just share my screen. Thanks for having me here. Okay. Here we go. Okay, thank you. So I'm Itai Chayut. I'm the CEO and co-founder of Scopio Labs. Scopio Labs is a startup company with offices in Tel Aviv and New Jersey. And what we've basically done at Scopio is we've developed a technology that enables to scan microscopy slides in higher resolution than any existing solution and using relatively low hardware cost. So this enables us to basically offer two types of analysis as a service on top of these digital images or digital scans. One type of service is AI platform that we developed. We already have a CE approved first platform for peripheral blood smears analysis with AI. and the second one is coming, and we have a pending FDA already submitted. And another type of solution that we provide is remote consultation, because once the data is digital, the expert doesn't need to be physically next to the sample, which creates a lot of efficiencies and kind of better care opportunities around health systems. When you think about how people are creating slide scan today in microscopy, you have either companies like Philips or like Biosystems that provide digital pathology solutions, usually 20x to 40x objective magnification, that is only good enough for, in terms of resolution, for histopathology, meaning tissues, right? When you go to cells, bacteria, and all these things that require a high resolution, you don't have technically available solutions to scan the slides. What you do have is you have some companies like Cellovision, ASI, and others that can provide individual snapshots of single cells and do some initial analysis on these. And the technological breakthrough that we're providing at Scopio is the ability to scan whole slides, right, at the highest resolution. It means that it's not only for histopathology, but it's also for all these other applications with very exciting opportunities that these things kind of bring to healthcare. Right. The way we do it is, we don't actually use the same very delicate mechanical scanning that other companies are using to physically scan the slide using a very high resolution lens. What we do is we actually have a low resolution lens with very large field of view, and we take multiple images with different illumination conditions, and we use computational photography techniques to computationally reconstruct the high resolution image from these multiple low resolution images. We have a broad IP portfolio, both internal and also some that was licensed from Caltech in order to provide this. This enables us to first do a whole slide image at the highest resolution, higher than any existing solution, but also we shifted all the heavy lifting from very expensive hardware in terms of mechanics and optics into computational photography, into GPUs. I'll give you an example about what this looks like. For now, what you can see is a blood smear. It's a peripheral blood smear. This is the only system in the world commercially available that enables to scan a slide like this at the adequate resolution, which is 100x oil immersion equivalent resolution, right? Can you? I hope that you can see my screen, but what you see here is red blood cells, white blood cells, and not just 100 individual cells like maybe other system can provide, but millions of cells. The ability to remote consult and provide information about what's going on here by an expert, and the ability for AI to analyze this thing and provide a quantitative results of what's going on here as a decision support system is also very exciting. We can also do histopath and other cytology slides. Anything you can do on a bright field microscope or a device can produce. And because of a low hardware cost, our entire business model is not actually about selling the hardware. It's about providing these as a service in terms of the AI and the remote consultation. We'll go back to the presentation. So our first kind of fully regulated product that's in the way, because we also have a very rapidly growing veterinary business, which I won't go into in this presentation, using the same technology. But in hematology, we've decided to do the first kind of end-to-end, fully regulated. It's already CE approved, going to be FDA approved soon. It's already submitted, and with several hospitals as partners, leading hospitals in the world. It's a solution for hematology labs. And what you do here is you not only scan the slide, but the system also analyzes the slides with AI. Just a second. Sorry, I have a video issue here. So I won't show the video, but the system actually scanned the slide and pre-classified the cells for 17 classes of white blood cells, automated kind of platelet detection, and many, many other things. The expert actually looking at the pre-classification cells, all these hundreds of cells, and then you just review it. It saves 90% of the expert's work, but actually provide better results. Like someone said before me, and many people are kind of arguing, we also very much believe in this. The collaboration between AI and an expert will provide and can provide the best results, much better than each one of them separately, right? But also, besides the AI, right, what we also have here is the scan slide, which I showed earlier. So the expert always have the raw data to look at. Move forward a little bit. So in terms of what we're looking for, in terms of partnership opportunities, we are already in discussions in the US and Europe about all kind of distribution agreements for the hematology products. We are interested to understand what are the distribution opportunities in Asia, specifically in Japan, for distributing our workflow solutions for hematology and pathology labs. And another very exciting direction and several projects we started lately is collaboration with pharma companies and clinical research. When you come to think about it, you have information about cells is comprised either by genetic testing, next generation sequencing, which is not very specific, PCR, which is specific only to something that you're looking for. You can also do FACS, flow cytometry, and look at some surface proteins as the phenotype that is being expressed on cells. But what we're doing at Scopia is we're, for the first time, looking at the morphological phenotype at scale, not 100 cells like a person could look at and maybe a cell-locating device, but tens of thousands or hundreds of thousands of cells from each patient, and see what is the expression of the genome in the morphology and what this means, right? This has broad implications for hemato-oncology research. We have a very exciting project there, and I'll be happy to discuss this as well, right? The company is comprised of an experienced team. All were involved in other companies as well. And like I said, offices in Tel Aviv is the main R&D center, and New Jersey as a kind of commercial office. That's it, and thank you very much.
皆さん、Thank you. 以上、医療機関での取り組みから各企業の技術を見ていただきました。では、具体的にイスラエル企業とのオープンイノベーションの進め方にはどのような形が有意義なのか、コランダムイノベーション CTO 武田健二様よりお話しいただきます。武田様、よろしくお願いいたします。
どうもご紹介ありがとうございます。コランダムイノベーションの武田でございます。激変する世界の市場環境の中で、自社の、事業の競争力の強化、これを図っていくためには、やはりオープンイノベーションが不可欠です。そういうことで、多くの日本企業が積極的にオープンイノベーションに取り組んでおられますけれども、なかなかこれがうまくいかないっていうお話も聞こえてまいります。特に世界のトップ企業、もう300社以上が拠点を置いてオープンイノベーションを展開しているイスラエルにおいて、これはどうやったらうまくいくんだろうかっていうようなお話をしてほしいというご依頼がJETRO様からございましたので、私どものこれまでの経験から少しお話をさせていただきたいと思います。ちょっと画面共有をさせていただきます。いかがでしょうか。
はい、大丈夫です。お願いいたします。
はい、それじゃあどうもよろしくお願いいたします。ということで、イスラエル企業とのオープンイノベーションの進め方ということでお話をさせていただきます。まず私どもの会社は、イスラエル企業とのオープンイノベーションを通じて日本をもう一回強くしたいと、そういうミッションでもって会社を作りまして、今から6年ほど前に創業いたしました。で、その当時はですね、イスラエルはスタートアップネーションということで世界中で有名で、世界のトップ企業が300社以上が活動拠点を持って活動しておりましたけれども、その時点では日本企業の存在感ほとんどゼロだと。こういうことで私ども、その危機意識を持って会社を創業いたしました。その翌月ぐらいにネタニヤフ首相が、安倍首相を訪ねられてから、イスラエル大使館、またJETRO様の、非常なご努力によりまして、現時点では非常に多くの日本企業が、イスラエルに注目するという状況になっております。私どもは創業して、まず 日本企業の戦略投資に限定したファンド、後ほど申し上げますけれども、やはりファンドの投資活動がないとなかなかオープンイノベーションはうまくいかないということで、ファンドを作りまして、もう日本企業様だけに出資をしていただいた投資活動を始めました。投資の分野というのは、多くの日本企業が直面している課題、デジタルトランスフォーメーションとか IoT の分野と、それからこれまでどちらかというと、工業製品ということで特化してものづくりで発展した日本企業にとって新しい産業分野を生み出すライフサイエンスと、この2つの分野に特化して投資活動を通じて皆様にオープンイノベーションのチャンスを提供しようということで、コランダムメソッドサービス CMS というサービスを提供開始をいたしました。それから約4年半が経ちまして、現時点では投資活動としてもかなり良好な実績を収めておりまして、約28社投資をした中で、ライフサイエンスは5社ほどございます。ここに名前がございますけれども、私どものそのファンドのホームページを見ていただければ分かりますが、この中でもそのダイロヘルスというのが、どちらかというと今日のテーマであるデジタルヘルス、糖尿病をスマホベースで、観察、モニターするというようなサービスがやっております。で、一方で、そのオープンイノベーションをご支援するというサービスに関しては、私どもの顧客企業というか、投資していただいた企業様には、延べにして約1000社近くのご紹介をし、その中から興味を持っていただいたところの調査を93社、そして顧客企業による投資活動まで結びつけるというようなことをやってまいりまして、今年7月から2号ファンドの募集を開始するという状況にございます。このほか、こういった活動を通じて、イスラエルの非常に尖ったスタートアップの日本市場開拓、これなかなか日本市場の開拓が難しいので、この辺を手伝ったり、あるいはもう分野に特化してイノベーションを生み出すような活動ということで、脳科学、そして今年はマイクロバイオームという分野に関してイノベーション創出事業を開始しております。また、日本の若手起業家とか、企業内の社内ベンチャーを立ち上げようというような若手エンジニアをですね、年に1回、イスラエルで2週間強のブートキャンプで、私どもの人脈、ネットワークを使ったプログラムで、育成事業をすると、こんなことをやっております。さて、オープンイノベーションの推進ということをですね、ステップを追って状況を申し上げますと、これ皆さん直面している現在の主力事業からどうやってこの直面する市場変化を突き破るような新しい将来の主力事業を生み出すかということが大きな課題、オープンイノベーションの課題でございます。で、この状況、この直面するリスクというものがコロナでさらに加速をしていると。デジタルトランスフォーメーションをはじめとしてですね、大きな市場変化に直面しているということです。オープンイノベーションを推進される多くの企業様とお付き合いをしますとですね、我が社の強みを生かした事業を生み出したい、シナジーのある事業に乗り出したいと、こうおっしゃってるんですが、私の印象ではシナジーとか自社の強みを強調しておられる企業さんはなかなかオープンイノベーションが進まない、うまくいかないという感じがしております。むしろ投資家の目線でこの事業は面白いなっていうものに対して自社のリソース、資金であったり人材であったり技術、あるいは自社のブランドや営業網をつぎ込んで育てると、こういう発想の方が前へ進むんではないかなというのが私の現在までの経験上の、知見でございます。で、そうなりますと、その狙った市場にすでにプレイヤーとしてもう顧客を持っているようなところを買収するっていうのが一つの方法であります。この M&A は最近の日本企業は大変活発になり始めております。ただ、実際には新しく乗り出すためには、そのマーケットでまたその革新的な付加価値をつけていかなきゃいけないと。こういうシーズンを生み出すような企業をまたオープンイノベーションに取り込んでいくというのがまた重要な課題ですが、このようなシーズンをたくさん生み出している、たくさんスタートアップがあるのがイスラエルということでございます。こういったその企業をオープンイノベーションの相手を探索したり、調査したり、交渉したりっていうのが、皆様のオープンイノベーション活動の中心業務なわけですが、基本的には、最終的には買収ということを睨んだシーズンの獲得ということがポイントになってまいります。オープンイノベーションを少しフェーズに分けて考えておりまして、まずはその有望な案件を探さなきゃいけないと。 で、これのマイルストーンをしっかり期限を決めてやっていきませんと、これだけでも大変時間がかかってしまいます。で、これを次にですね、絞り込んだ広報企業に対してどういうオープンイノベーションを展開しようかと、こういう戦略を練らなきゃいけない。で、これも最終的にはその計画を作るところをマイルストーンとして、ある期限を決めて進めていくと。で、絞り込んだ相手に対してその提携交渉を進めていくと。で、これは最終的には直接投資をする、あるいは買収をするというところをマイルストーンにしていくわけです。最初のこの有望案件を見つけるというところのこの案件を見つける力っていうのが非常に重要です。イスラエルではもう世界のトップ企業が年間700社ぐらい誕生して全部で6000社以上あるようなスタートアップの中からみんなで競って有望な企業を探しているわけですから、ここでその他社に先んじていい案件を見つけるっていうためにはですね、やはり有力個人投資家とか有力なベンチャーキャピタルとのパートナーシップというのが非常に重要です。コンサル会社とか調査会社ではなかなかこういった掘り出し物を見つけるっていうことにはもう特にステルスと申してですね、いい投資家がついているところは製品を本格的に売り出すまではホームページも出さないという、いわゆる見えない企業になってますので、こういう案件を見つけるのが非常に重要になります。それから見定める力、これもですね、今日のピッチもありました、面白いなと思ったら、もうちょっと知りたいと言ってアプローチしますと、NDA を結んでくれっていう話がまず起きてまいります。しかし、安易に NDA を結んでしまいますと、その後の事業展開その他に非常に制約を受けるので、ここをいろいろな裏情報も含めて収集する力ということがポイントになってきます。そして最後に交渉。この際には相手との信頼関係を早く築くこと、それからやはりその裏情報も含めて相手をちゃんと見定めていく過程で、交渉を進めていくと。これが重要になってまいります。事例で申し上げますと、私どもに出資していただいた、一つの企業様の話ですけれども、これは関心領域はアグリとかエネルギー、こういったところにご関心があって、そういったところを私どもが探してですね、毎月定例会議やなんかでふるいにかけていくというようなことを一緒にさせていた。こんな表を作っておりますけれども、こういう過程の中で絞り込んで、出資後3年強の間で私どもは300社以上ご紹介して、ご一緒にスクリーニングしていって、絞り込んでいって、で、その間に役員クラスの訪問も3回ぐらいしていただいて、最終的には、少数株主としての直接投資を実現して、日本とアジアへの代理権ぐらいを取ってですね、今、進めているという状況にあります。それからそのイスラエルのそういったそのスタートアップのエコシステムの状況をご理解いただくために、私どもが投資した会社で、まず4年で、世界のトップ企業に買収されたケースをお話ししますと、先ほど言ったステルス、これはもうエリートのその国防軍8200部隊出身の若い創業者が作ったものをですね、もうイスラエルで最も有名なゾファー・ジサペルさんという投資家がまず投資をして、そしてその声掛けで有力のベンチャーキャピタルが投資をしたと。これが私どものパートナーのバーテックスだったもんですから、私どもはここでステルスであるにもかかわらず、この会社の存在を知ったと。で、ところがこれ自動車用なので、世界ナンバーの自動車メーカーもある日本で営業しなきゃいけないというので、私どもがそれをヘルプした、助けたということで、次第にバリューが上がっていってですね、それでシリーズ B の増資の時には、世界のトップ企業 CVC2 社が出資しておりますが、これもこちらから選んでお声掛けをして、一つはサムソン、一つは損保の世界大手のアリアンツというところに出資をしてもらって、さらにバリューを上げていって、バーテックスに出資していた、でモニターをしていたドイツの、コンティネンタルという自動車実装大手のコンティネンタルが最終的に買収をしました。この時にも日本の電装品の大手も応札をしてですね、一種のオークションになって4億3000万ドルで落札した。こんな経緯をたどっていくのが、いわゆるオープンイノベーションでございます。ちなみにこの時買収したコンチネンタル社はご存知の方も多いと思いますが、そもそもが自動車用タイヤの世界大手なんですが、日本のブリヂストンをはじめ、そういう過酷な競争の中でタイヤから抜け出して、2000年頃からシーメンスとかモトローラの自動車前装品部品部門を買収して、そして最近では今度はソフトの会社を買収して事業の構造を大きく変えていると、こんな状況でございます。 ここ最後は今日のテーマであるヘルスケア分野でイスラエル企業との協業の時の課題ということで申し上げますと、これはヘルスケアに限りません。イスラエルのスタートアップ企業と、オープンイノベーションをするときには彼らのその基本をよく理解をして、ということは彼らはスピードです。ともかく早く上場なり買収なりゴールへ目指して走っております。そのスピード感と、そこには必ず投資ということが前提になります。こういうことでですね、こういうところと付き合うためには基本的にはいつでも投資をすぐに決めるぞというスタンスでないとなかなかまともには付き合ってもらえないということでございます。ヘルスケアについて言いますと今日のお話もありましたけども、対象市場が重要です。ご案内のように日本の市場は非常に難しい。仮にデジタルヘルスも含めて提携をしてもすぐには行きません。規制も強いし、そもそもマーケットは成熟してます。今回のコロナでも分かるように、日本は国民皆保険ということで、ある意味で非常に満足度が高いので、ベンチャーの新しい技術をすぐに取り入れる状況でもない。大手も含めて過当競争で。むしろ、今日のスタートアップの皆さんにもありましたように、イスラエルは世界市場を目指していて、まずアメリカの FDA を取得しているというようなことがあります。したがって FDA さえ取れていれば、そのまま参入できるアジアの市場とかですね、そういうところに最初に申し上げましたように、日本の企業が持っているブランド力とか営業網とかを使って育てるというような、こういう視点も必要ではないかと、こういうふうに感じております。以上でございますが、来週に私どものでも主催したCOVID-19 イスラエルがもたらすコロナ後のビジネスチャンスというセミナーがございます。在日イスラエル大使館経済部のホームページにも掲載されておりますので、ご関心のある方はご参加いただければと思います。どうもありがとうございました。
貴重なアドバイスありがとうございました。皆様、本日はデジタルヘルスサミットをご視聴承り、誠にありがとうございました。第2部ご参加の皆様、引き続きよろしくお願いいたします。また、第2部個別会議におけまして、後日の日程にてご調整いただいております企業様へこの場をお借りし、お礼申し上げます。繰り返しになりますが、登壇者をはじめ、今回2カ国会におけますイノベーション取り組みなどにおけますご質問は、JETRO および経済部にて受けてまいります。今、こちらのスライドにてご案内申し上げております。E メールアドレスまでお手数ながらご一報お願い申し上げます。また状況が落ち着きましたら、皆様へ改めてイスラエルへのご出張もお願い申し上げたく存じます。最後ながら、医療関係の方々へもこの場をお借りし、感謝申し上げます。では、これにて当ウェビナーを終了させていただきます。本日はお時間どうもありがとうございました。